make some system updates for that group as well. So those people were restored and put into this group as well, though the majority is the OSIPM folks that we refer to in that first group who are heavily disabled or blind or aged. Then there's also the other household members of the group. So you'll see some other folks who just happen to be in a household with one of the other two groups of members in there too. So since these people were previously closed in many cases and then restored, if their income or other situation hasn't changed, in many cases we expect the same outcome. So we want to make sure people are updating their information and using the extra time they have from the renewal update, the revised renewal process with the new notices and whatnot. We really want to make sure that they're getting the information that, if any of the information that's the decisions being made based on is incorrect, that they tell us about those changes, and hopefully that gives them the opportunity to retain benefits than they might not have otherwise. Otherwise, if truly nothing has changed, we would expect a somewhat higher termination rate among the remaining group. Other major step we took besides those system changes that happened in May, both to this renewal process itself and the notices, was to spread this renewal population out. There's about 120,000 people in the total renewal group. That would have been something that we could have done in a single month of renewals earlier on in the unwinding process. We're spreading that over 4 months in order to allow for more support for each case going through this process. So more staff time is available. The hold times are more manageable during all of this. So right now we in August are in the third month of outgoing renewals. In about 3 weeks, we'll have the 4th month of outgoing renewals, the delayed ones, sent out to members. So that'll be in early September. At that point, we will have all of the renewals that are part of the unwinding process initiated, and then we'll be going through the long tail of people responding to things, slowly closing benefits, and then getting people through people's reconsideration periods. So the first renewals that were part of this summer have until the end of September to respond. If they don't respond by then they get a 60-day closure notice, which would close their benefits at the end of November for non-response. And then up until February 2025, that person could still provide the information we're missing and get their benefits reopened without a new application if they're still eligible. And then for each month subsequent, the timelines are delayed. So we are wrapping up with the final closures in February 2025, and then the final reconsideration periods will end in May 2025, and unwinding will be formally and fully completed at that point. What we're seeing in the data for the renewals so far is that the renewals are vastly more likely to be over 65 or have a disability. 49% of the renewals in those 4-month waves are over 65 compared to 9% of the overall population. So that's more than 5 times more likely to be disabled, or sorry, over 65. For people who are in that summer group, 65% of them identify as having a disability compared to 18% of the overall OHP population. So we're seeing it's more than triple the likelihood of being disabled. So given that this is a really high priority group to have the additional support to get through the renewal process, just on that basis alone, even if there was an additional complexity to these members' renewals. What we are seeing in the renewal data so far is that it is far more common for these renewals to be an active renewal as opposed to being passively approved. Earlier in the renewal process, almost 2/3 of renewals were being passively approved, as opposed to now we're seeing almost 2/3 of them go into an active renewal where a response is required. So we're seeing more responses needed out of this population as a consequence of them being on the programs they are and whatnot. We're also seeing some effects in the types of requests that they're getting asked for. The most common request right now in July renewal data, at least, was for a request for an interview. Very similar numbers for an internal pen for asset verification. That is a worker pen, not a thing partners need to respond to or the member needs to directly respond to. But those pens are really unique to the non-magi, what we mean when we say age and disability-based programs that can ask for the financial resource questions as well as the income-based questions. The interview for that eligibility step is coming up as the most common request type on there. So we really want to highlight that that's going to be a very common thing that members are needing help with, is scheduling that interview. Along those lines, we wanted to put together some additional support for these groups. So we've got multiple efforts going on to try to get these members connected into that interview, understand the importance of responding to renewals and whatnot during the summer. The first one is through people who have a case manager. Not everyone has a case manager, but if you have long-term services and supports, you might. For people who have that case manager, which just involves ongoing monthly contact with that person, we wanted to use that personal connection that the case managers have with their clients to remind them to renew, to help schedule interviews and things like that. So they're receiving at least one outreach from that case manager if they have one through those benefits. Then on a broader scale, we're also doing some outreach to people who haven't responded at their 30-day warning letter and 60-day warning letter. So when they have that amount of time remaining in the process, we're hitting that for the first wave right now. We're going to have our call center staff, through technically it's PH Tech, the support function within our call center. They're going to be reaching out to members and doing those same sort of reminder calls, as well as scheduling interviews if they're close to their due date. They're going to be going through 3 different groups of members that have some overlap. The first one is Oregon Supplemental Income Programs who have the long-term services and supports. We are also going to be doing, so that group will double up with the people who have case managers because they have the long-term services and supports. So one group will get 2 waves of outreach. And then for the second 2, the Medicare Savings Programs members and the Oregon Supplemental Income Programs who do not have long-term services and supports, they'll just be in the reminder call effort where they will get that call when they haven't responded by the 60-day or 30-day warning mark. They will get these calls from the call center in order to actively encourage them to respond to the renewal, answer some basic questions, and really get that interview scheduled. So I'm really hoping to drive that forward, and the active outreach will hopefully help more of these members respond. So we're trying to pull out all the stops we can to get those key messages out there. So on the partner front, we did share some messaging last month about what people can do if their resources are, if they're found over resources. Specifically, they may have options to redistribute those finances to remain eligible if they want to. But the key message there is that they need to talk to an eligibility worker before making any financial decisions. Partners can't give legal advice or financial advice. Talking to that eligibility worker is really the key step there if anyone's being denied over resources and has questions about that. There are concerning reasons on each possible direction here. We don't want people to accidentally go without benefits they're eligible for. We don't want people to accidentally disqualify themselves from eligibility through financial steps or take steps that aren't necessary, like selling a house in order to qualify. It's really important to talk to an eligibility worker about those sort of questions. So that's really one of the main messages we want partners to drive. And then the other one for people losing benefits is if someone has Medicare and is losing their full OHP benefits, whether they're losing benefits entirely or going to just a Medicare savings program, they may want to consider their Medicare plan choices, such as Medicare Advantage, Medigap plans, Part D prescription plans. Those sort of Medicare options may change when they lose what decisions would be wise for them may change once they lose the full OHP as well. So we really want them to connect with a trained Medicare choice counselor. The Senior Health Insurance Benefits Assistance Program, the SHIBA counselors, you may know them as, are the kind of the equivalent to assisters for Medicare choice counseling. We would really encourage you to refer as many clients to them who are needing that sort of assistance and making sure they connect there. And even if they're not keeping medical benefits with us, that they're getting those care plans to rotate over and maintaining access to the services they need. So those were just a couple of messages we're trying to drive at the moment. Otherwise, before we move on to OHP Bridge side of things, I just want to take a moment for questions on the unwinding part.
Hi, Sean. I'm going to give people just a minute or 2 to pose any questions. And yeah, if you got anything you want to throw in the chat, please let us know. Going once, going twice. All right, we'll have a little time at wrap up too. So if you guys needed some time to think or you've got questions about synthesizing all the information, there'll be time at the end for that as well. Oh, there we got one. Could you speak to the language differences in the summer renewals?
Is that referring to the new notice templates and whatnot?
I'm happy to clarify. I'm sorry, chat can be hard to synthesize like a question in a short I was curious because you shared a little bit about some of the summer trends of more likely to be a little older than the previous benefit periods. We sort of heard through the grapevine through other agencies that um, there are some differences sometimes in populations who speak Spanish or Russian, and so I was curious if OHA had observed any particular demographic differences, language differences in this final summer period.
I haven't rerun the demographic numbers for the summer period yet. I'll have to take a look at that again. We recently got that data access restored, so it should be feasible to do again. Earlier in the pandemic unwinding process, we saw most languages were actually doing quite well on response rates, Spanish in particular, which probably speaks to the strength of the community partner network so heavily prioritizing Spanish. But whether or not that's continued for the summer renewal group is something well worth looking into that I'd love to report back next month on.
Thank you, Adrian. All right, we'll move on to our next presentation.
Alrighty, well, I will introduce Katie Waldo with our OHP Bridge team, who's going to be taking this section.
Yeah, can everyone hear me?
Mm-hmm.
Okay, great. I've had to restart my computer a couple times today due to tech issues, so just wanted to make sure. Hi, everybody. For those of you who haven't met me before, my name is Katie Waldo. I use she, her pronouns, and I am the lead project manager for OHP Bridge at OHA. So we'll be doing a quick intro today, an overview for those of you who might be joining for the first time. So OHP Bridge is a new benefit for adults with higher incomes in Oregon. In order to qualify, you must have an income up to 200% of the federal poverty level, be an adult, so age 19 to 64 in this case, and we'll get into that in a minute, and not have access to other affordable health insurance. You also have to have an eligible citizenship or immigration status to qualify. OHP Bridge is very similar to OHP Plus as far as the benefit package with a few minor differences. However, it is also like OHP Plus, it's free coverage with no member costs, including copays or deductibles. Right. And so we have one benefit package, which is the OHP Bridge benefit package. It's BRG as the code. And two programs that deliver that same package. So the first is OHP Bridge Basic Health Program. This is where a majority of OHP Bridge members will receive their coverage. This is managed exclusively by CCOs due to federal regulation, so it does not have an open card option. OHP Bridge Basic Medicaid was the program created in order to preserve the right to choice between CCO coverage and open card for our American Indian and Alaska Native members. So this will be a significantly smaller population, but if you do have American Indian and Alaska Native members that you work with, this is the program they would be eligible for. We launched July 1st, which we're very excited about. So far, we have a little over 25,000 members. A little under 23,000 moved to OHP Bridge effective July 1st. We had about 1,600 people that remained on the temporary Medicaid expansion pending further review. So they have received RFIs. We just weren't sure on a couple of things and needed to get some more information for them to make sure they're going to the right place. Roughly 1,300 people moved to another medical eligibility category, such as standard Medicaid or Medicare. And then about 3 people were closed due to a valid reason, such as them closing their coverage on their own. So we're pretty excited about the launch so far and to see these numbers continue to grow. We will have people moving from 3 primary areas over the next few years on to OHP Bridge. So the first is our group moving from the uninsured crowd. So we're really excited to see these people get access to healthcare coverage. And they became able to apply for OHP Bridge starting on July 1st. We'll also have some folks moving from the marketplace. So these are people that fall within about 138 to 200% of the federal poverty level who were previously receiving coverage through the marketplace and are now eligible for OHP Bridge. And they'll move the most gradually, we expect. So over the course of 3 years due to automatic enrollment and other factors. Then we also have people that are moving over from the Oregon Health Plan. So individuals that, again, fall between that 138 to 200% of the federal poverty level and who were already on the temporary Medicaid expansion automatically moved over, as we discussed in the previous slide. And then additionally, people who see their incomes fluctuate above that 138 mark going forward will be able to move on to OHP Bridge as opposed to churn on and off the marketplace and OHP. So we've been receiving a couple consistent questions over the past two previous office hours regarding continuous eligibility and OHP Bridge. So we wanted to cover it a little bit in this section. So we have this visual here. I'm not going to cover all the details in the visual, but we wanted to make sure you had access to it because it's got some really great information. So you'll be able to reference this in the slide deck later. But the big things that I wanted to sort of point out here is that OHP Bridge Basic Medicaid will have access or will utilize the continuous eligibility that you see in OHP Plus. The only difference between, or one of the main differences between the two is that coverage will end for basic Medicaid members if they enroll in another form of health coverage, but otherwise they'll get that standard 2 years that OHP Plus members get. OHP Bridge Basic Health Program, however, will have a 12-month coverage period. So during that time, they will, assuming that their income changes, they will be able to continue to stay on OHP Bridge Basic Health Program until that 12-month period ends. For them, if they receive access to or enroll in other health coverage, they will also lose OHP Bridge Basic Health Program. So those are some of the key points that we just wanted to make sure were called out. But I do recommend that everybody take another look at this slide after, just to see the details and the differences. We also wanted to call out a few small differences in how income eligibility is calculated between Basic Health Program and Basic Medicaid. So due to federal regulations, OHP Bridge Basic Health Program requires us to use an annual income limit when we're calculating income eligibility. So that will be 200% of the federal poverty level for your annual income, for a member's annual income. For Basic Medicaid, it follows closer to OHP rules, so we will be using a monthly income limit of a 205% of the federal poverty level. With that in mind, we want to note that everybody applies for this program through the same application, and that application analyzes people's eligibility for a wide variety of programs. So it will go through a hierarchy of programs in order to get the person the best option that they have access to. And so it will check somebody's application first for OHP Plus, which goes up to that 138% level. Then it will check their eligibility for Basic Medicaid. So if they're an American Indian and Alaska Native member, this is the one that they will ideally go into. And then it will continue to move down towards Basic Health Program and some of our other programs as well. So we really encourage people, as opposed to getting a little too focused on 200 versus 205, if you think someone might be eligible, please have them apply, and the system will analyze where they might fit and what benefits they can get. So we also have had a lot of questions about how the enrollment timelines work for OHP Bridge Basic Health Program, because it is a little bit different than our other OHP programs, and it's a bit confusing navigating between the two. So we are going to provide both a verbal explanation, and then we'll show a visual as well, in case you're like me and you work a little bit better with visuals. So for our Basic Health Program members, if they apply and are deemed eligible before the 15th of a month, then their coverage will start the first of the next month. So for instance, if they were to apply and be deemed eligible today on the 13th, they will receive coverage starting September 1st. However, if they apply and are deemed eligible following the 16th of the month or till the end, they will start receiving coverage the month after that. So if, for instance, someone were to apply and be deemed eligible this Friday, August 16th, their coverage would begin on October 1st. And we'll show that here in a second. You can also see the timelines and more information at the OHP Bridge website, which we'll talk about more here in a bit. So to show this visually, looking at the month of October here, so this box in the far left corner, if someone applies and is deemed eligible in the orange section of that box, so the 1st through the 15th of October, their coverage would start at the orange box in November, so the 1st of November. If they applied in the blue or in the purple section, so the 16th through the 31st, and were deemed eligible during that period of time, then they would start receiving coverage in that little purple box in December, so the 1st of December. So we know this is a little bit different. We really want to provide as much information and resources as we can in understanding this, because we know it might come into play when people consider when they're applying and how they're applying. So these visuals are available through, I believe, through our toolkit for our community partners. Yep. And it also includes a visual for basic Medicaid as well. So. When it comes to basic Medicaid follows our sort of standard OHP rules. So you shouldn't experience much difference there, and that should feel very similar to all of our other OHP programs. So we just wanted to reaffirm that piece for those that were wondering the difference there. And again, there's a visual explaining that as well within that partner toolkit. So part of what brought this discussion up was that we had some community partners, some fantastic community partners, which we really appreciate, as well as some internal staff call out that there was a little bit of confusion around what happens when basic health program members move service areas. And the reason this was of concern for people is because of that lack of fee-for-service component that we covered earlier in the presentation. So unlike traditional OHP, where if someone moves from one CCO service area to another, typically what we would do in that case is put somebody on fee-for-service for that short period of time while we're getting them reassigned to their new CCO. Unfortunately, due to federal regulations, this is not an option for the basic health program. Somebody does have to be actively enrolled in a CCO in order to receive coverage. So due to, we've got some, I think it's called CCO auto assignment is now up and running, which has shortened our period, which is really exciting. But there is potentials for some very small gaps in coverage for members on OHP Bridge Basic Health Program due to this lack of fee-for-service option. And so we have currently are working with our team internally to do some manual reassignment in order to limit that and get people reassigned within a day. And we do also expect that due to, it is still going to be a really short period of time. It's unlikely most people will experience an interruption in service due to this. We do want to call it out. So I think we can go to the next slide. Yeah. So as I said, in most cases, the gap will not affect members' coverage because we've got a manual process set up internally that our eligibility workers will use to get people reassigned as quickly as possible. However, if somebody knows that they might be in need of urgent care, or for instance, a prescription maybe is going to run out and need to be renewed in the 1 to 2 days, during which time they're sort of being changed over to their new CCO, we encourage them to reach out and call client services and let them know as soon as possible at the number on the screen. Yes, Sean.
Yes, just one clarification there. If you've got a client who's already run into the problems, call client services, not email them. If we do anticipate in advance, we ask when reporting a change for an OHP Bridge member, we encourage you to ask them if they're anticipating care in that gap. If you can do so in advance, here's the email template slide for how to do all of that. But call them if there's an urgent issue is the other part of that.
Yeah, we understand that sometimes people don't know when they will need care. So if it is an immediate, unexpected need for urgent care, please use the phone number. However, like Sean said, if you know something is coming up that might be impacted during this change, you can email the email on the screen, use the subject line that's listed there, and we ask that you make sure that the information that's listed here is also included in the body of the email so that we can help you as quickly as possible and really do our best to prevent any potential interruptions to care. Yeah.
Alrighty.
Okay, so once again, we know that this is potentially going to be a little bit confusing as we especially navigate the differences between the basic health program and the basic Medicaid programs. So we wanted to just remind everybody that if you have questions, you can reach out to your regional outreach coordinators through CPOP. You can also email the OHP Bridge email that's on the screen here. That's how we collect questions for this webinar series, and we'll be going over that again in a second as well. We also have the several different resources, and I believe we've got some slides that'll cover this here in a second too, that we want to make sure you're all aware of are available to you to get more information, both on the program more generally and on some more technical issues like the one that we just discussed. So the first is our partner training, which became available as of May 15th. It's available in English and Spanish at the links on the screen. And it takes roughly an hour to an hour and a half to complete. It's got some really great information in it. We were strongly encouraging people to take it before July 1st, but I want to highlight that it is still super helpful to take, even if you haven't, even if you didn't get to meet that suggested date. So we really encourage people to start there. And then we've also got some resources on our website. So our website, we're continually updating it, especially in these first 6 months while things are, we're kind of working out the questions and concerns from the community. So two of the primary resources that we have for you all is our FAQ, which we are constantly updating in part through this process that we're having right now. When we receive questions for you all, we start to try and note when we're getting repeat questions that might need to be added to that document. We're also working to refine the questions a little bit to make them a bit easier to find. For now, I do recommend using a keyword search. If you're looking for a question and you don't see it, using words like application or applying will help you find information on how to guide members through that process if you're not finding it immediately in the list of questions. We also have an outreach toolkit, which has a bunch of resources for our community partners that they can use to help guide members and potential members through the process of applying and receiving their benefits. Those are all available on the website. Like I said, we've got English, we've got Spanish. And then our CPOP partners also have income guidelines that are updated, and those are available on the forms server and the group site. I know that was a lot of information. Some questions, many questions will be answered in the next section, but I do want to pause for just a moment and see if there are any immediate questions before we dive in.
I am taking a look and I'm checking both our chat and our Q&A feature. I'm not seeing anything, and I just wanted to just bring attention to, I also added those links to the bridge pages in the chat as well. So a direct link, you can click them.
Thank you so much. Okay, I think we can dive into questions. All right, so just as a reminder to everybody, tell your friends, tell your coworkers, we do have this lovely Assister Community Partner Inquiry process, and that's this office hours is a part of that. So assisters and community partners can submit questions to our team in a couple of different ways. The first is through your regional outreach coordinator with CPOP. They will sort of compile questions that they receive at meetings and through emails, and they send them to us. The next is via our OHP Bridge email, which is on the screen, and that comes to our team, and we again compile the questions and get them answered for this office hours. You can also submit questions via the registration form for this webinar, and then you can also just attend the meetings and ask us questions during the meeting. That works great too. The way that we compile questions is we receive questions through our emails, our rocks, those registration forms, and we accept questions up to a week prior to the upcoming office hours, and then we compile them as a team. We answer them. We call in any policy people we need to get the questions answered, and then we present them at these meetings, and then we send out those answers to anybody that submitted a question via the inbox or their rock. Anything that's submitted in the week leading up to the office hours will be added to the next month following. So for instance, anything that was submitted to us in the past week will be answered in our September webinar. So I just like to put that out there so that people can keep it in mind when they're deciding sort of when to send us questions. With that in mind, I think we can dive into it. Okay, so we had a question regarding covered services, specifically whether or not OHP Bridge members will receive mental and dental coverage, or if they only receive one or the other, or just medical. So just to clarify, OHP Bridge members will receive the same benefit package, which again is that BRG code, and that covers medical, behavioral health, and dental. It's very convenient. We had a question about CCO enrollment. So this speaks to some of the things that we discussed in that sort of intro section. So whether or not members have to be, basically whether they have to be enrolled in a CCO. And just to reaffirm, OHP Bridge Basic Health Program members do have to be enrolled in a CCO in order to receive coverage. The only people that have another option is our OHP Bridge Basic Medicaid members, who again are able to choose between CCO and fee-for-service coverage in order to preserve the right of American Indian and Alaska Native folks to do so. So if they are a BHP member, which again will be a majority of the OHP Bridge members, they do have to be enrolled in a CCO. Okay, so this is a similar question regarding CCO enrollment, and just reaffirming that yes, basic health program members have to be in CCO, OHP Bridge basic Medicaid members do not. So that will be part of the process. And then we had some general questions about bridge eligibility and whether or not this is only for people on the marketplace, as well as how we just deem access to other care, whether or not it's affordable or not. So first question, this is not open just to people on a marketplace plan. This OHP Bridge is for adults with incomes between 138 and 200% of the federal poverty level who have qualifying immigration status and do not have access to another form of affordable coverage. The affordable coverage piece includes things like Medicare and employer-sponsored insurance. And we do use the same income affordability standards that the marketplace uses, so that's 8.3%. I do want to note again, that's something that the one system will determine for the member. So again, we encourage people to apply as opposed to try and figure out for themselves whether that percentage counts or not for them. So please apply. There's questions within the application that will help the system make that determination for them. We really want to push the message that we really encourage people to apply and let the system help them navigate that, as opposed to try to do the calculations and whatnot themselves, because it is super confusing. So we had another question regarding income limit comparisons and whether we have that somewhere. So we do, it's great. We have a comparison of the income limits on between OHP Plus and OHP Bridge on page 4 of our FAQ. And it's specifically under the question on the screen here, just because we are updating that document. So the page number might change, but this question in the screen has that chart. I think the web page just has the up to 200%. We were trying to make it as clear and not confusing as possible, but if you do want to see the comparison, it is in that FAQ document.
And the updated CPOP income guide we referred to earlier in the presentation has that as well for your work purposes. So
thank you, Sean. Okay. We had another question regarding LTSS and HRSN. So we had someone asking us to explain what it means when we say that OHP Bridge will not cover LTSS and climate or housing. So earlier on in the presentation, you might have heard me mention that there are some slight variations between the OHP Bridge benefit package and the OHP Plus one. And this is one of the areas where there is a slight divergence. So at the moment, OHP Bridge does not cover long-term services and supports or health-related social needs. It's possible that in the future, as the BHP Trust Fund, which is the primary funding for OHP Bridge, grows, that we will be able to expand to cover these services. But at the moment, they are not included in the benefit package. And for those who are uncertain about what long-term services and supports are, it's a very broad category of services. So it includes things such as in-home care, placement in a nursing home or assisted living. And so we've included the links for both the long-term services and supports and HRSN here on the screen in case you want to learn more. Okay, so we had some questions regarding applying for OHP and OHP Bridge. So this is if somebody had applied for regular OHP or OHP Plus and were denied, will they automatically move to OHP Bridge if they are under the qualifications? And so just as we mentioned earlier, so the one system will sort of analyze someone in a hierarchy of programs. So they'll start with eligibility for regular OHP or OHP Plus. If they deem them not eligible, they will sort of move on next to basic Medicaid and then OHP Bridge basic health program. So the one system will evaluate their eligibility for a wide range of programs. And again, just to reaffirm what I said earlier, this is why we really encourage people to apply. And if they have been denied in the past, that we would recommend that they do so now again, because there are new programs such as OHP Bridge that are out there that they may qualify for. So if someone has been, and Sean, maybe you can hop in and help with this last part. If someone's been denied prior to June 28th, when OHP Bridge kind of went live, then if they would, we would want them to take another look and apply again because they might be eligible now.
Yeah, we just got a portion of that question that was asking if we were going to revisit those applications, and no, we can't. Is the fundamentally income may have changed, the months that we're considering are different, and we would need a response from the person to be able to move that forward.
Awesome. So we've got a question, which I think we also received a similar one last month regarding credentials for providers who want to register with our plan. So the first thing that we want to note here is that if you are already enrolled with your local CCO as a provider, you don't need to do anything different for OHP Bridge. It is included underneath that qualification. So and again, OHP Bridge members, vast majority of them will receive services through CCO. So you should be good to go there. And the CCO should be able to provide information on their rates specific to OHP Bridge. We had a similar question or an adjacent question here regarding quality payment programs. And we weren't 100% sure if this person meant the quality incentive program. But we did want to clarify that if they did, there's not a version of that for OHP Bridge. So, okay, and then we had a question regarding billing. So billing guidance specifically from OHA on this program. And so we wanted to reaffirm that there's two, there's one benefit, BRG, but there are two sort of programs underneath that. And so we recommend that that you reach out to your CCO regarding the specific billing instructions, because they might have things that are unique to them. So yeah, always, as we love to connect everybody with their CCO partners. They're great. So please reach out to them for things like this. Okay, question regarding EPSDT. And whether or not members would receive this. So yes, it is, but again, only for members who are 19 to 20, just reminding people that you have to be at least 19 to be on OHP Bridge. So it would just be that portion of the overlap of population. So people 19 to 20 would be able to get EPSDT.
Just realizing we didn't define EPSDT on the slide. That's the Early Preventative Screening, Diagnosis, and Treatment Program, which refers to the expansion of coverage for kids we did in 2023, where services that weren't being covered before, for instance, a lot of specialty care, things like that weren't previously covered, can now get covered through a request process. Those members have the same access to those broader range of services as other members if they're under 21.
Thank you, Sean. I do not remember all the words in that acronym, so I really appreciate that.
It's a tongue twister, that one.
Yeah. Okay. We had a question regarding assets, and because we know there are some OHP programs that evaluate for this and others that don't. So we had questions regarding if someone has a certain amount in their savings account, would this disqualify them? And are there other reasons than income limits that someone could be denied coverage? And we also had a question regarding retro coverage. So we'll hop over to the next slide to answer these. So OHP Bridge does not consider resources such as things like a savings account when evaluating for eligibility. And so they just don't apply in that way. You don't have to be worried about that. There are other reasons that somebody could be denied, such as some of the ones that we've listed, having access to another form of health, affordable health coverage that includes Medicare. So that would also make people who are over the age of 65 not eligible, or someone who has access to or is enrolled in an employer-sponsored coverage, but that has been deemed affordable. And when it comes to retro coverage, OHP Bridge Basic Health Program does not have an option for retro coverage due to federal regulations. That being said, OHP Bridge Basic Medicaid members might be able to receive coverage up to 3 months prior to their effective date, but that cannot go back past July 1st because the program didn't exist prior to that. So they will follow all the same timelines within the application as standard OHP for basic Medicaid. And yes, there was a question regarding cost to members and prescriptions. There are no costs to members on OHP Bridge, and it does cover prescriptions. Okay, I think I'm turning it over to you, Sean.
Yeah. And then this question was about how can we view OHP Bridge members and MMIS, and will they be visible before their coverage actually starts? And the answer there is to staff, yes, they can see the future start date, but the provider and partner view of MMIS does not allow you to see future start dates. So under the view that y'all have access to, it would only be visible once the coverage is actually started. So a member who has applied at the beginning of July and isn't starting until, or applied in July and isn't starting until September would currently not show up in MMIS for a partner view. But you will be able to use it to confirm coverage once that is started. MMIS is primarily designed as a billing system, so that's kind of following that logic there. So differences between staff and provider views on that one. We also got a question about whether over OHP Bridge, whether you can choose between that and COBRA, I guess, and how COBRA affects OHP Bridge eligibility. Basically, if they're enrolled in COBRA, but still within 60 days of their other coverage ending, they could still choose to end COBRA and get in the marketplace. If on the marketplace rules, if they basically, would an individual have to wait until the COBRA runs out to apply for OHP Bridge? And the answer is no. Same with the similar to the marketplace, people can access the marketplace or access OHP Bridge even if they're enrolled in COBRA coverage. If an individual wants to cancel that COBRA coverage after that point, it costs something per month and is usually fairly expensive. They may want to make sure that they're lining up those start dates with the OHP Bridge coverage start date. So don't go cancel your COBRA coverage as soon as you get approved. Look for that start date of when the OHP Bridge coverage is actually starting to make sure they line up. But like with unaffordable health coverage, being enrolled in COBRA will not prevent you from getting OHP Bridge. Same with marketplace transfers and things like that as well. We also got a question about household sizes and whether OHP Bridge and BHP and basic Medicaid count an unborn, someone who's pregnant, whether the unborn member of the family counts as an additional member of the household size for those purposes. And there is a difference between basic Medicaid and basic health program here. Basic health program is going to follow the marketplace rules where that unborn baby does not get counted as their household size. For OHP Bridge, basic Medicaid, on the other hand, it would. In most cases, that means the OHP income limit for pregnancy programs is actually going to be higher than the income limit for basic Medicaid. So it'll be fairly rare for people to end up on either program while pregnant. There are a few exceptions, such as basic Medicaid programs for people between 190 to 205% of the poverty level, where because it follows the same counting rules for household size, the income limit's actually going to be higher there. Or for people who have become pregnant while on OHP Bridge and then report changes, including an income change above the household limit, in which case they're just going to stay on OHP Bridge for the rest of their 12-month coverage period. So some pretty complicated differences there. Basically, they're going to get to keep that coverage, and it will be fairly rare for people to end up on OHP Bridge while pregnant. In most cases, they're going to move over to Medicaid, but for the cases that they do still get the same benefits. So bit of complicated behind the scenes stuff there that shouldn't affect the member too much. We also had a question here about whether the renewal process for Bridge will be like OHP, where they're, since the May system update, now getting the opportunity to respond before being terminated based on being over income or something like that. This person provided an example of someone who was on the expanded adult program based on their monthly income and then was denied denied OHP Bridge programs based on their annual. And they were wondering why that happened when they weren't asked for a response first. And specifically there is that the request is always going to happen during the renewal process, but the transition between temporary Medicaid expansion to OHP Bridge that happened in when we launched in July, that was not a renewal step. So there were certain possibilities for people to close at that step if their information was no longer going to be eligible for OHP Bridge. If you have a case that sounds strange, escalate it to your ROC, have us look into it. That's always something that's worth doing. But basically, in this case, that wouldn't have triggered the response window. If the information that decision is being based on has changed, we really need to hear that so we can rescreen that person for eligibility. But the main crux of that question was that the switch from OHP to OHP Bridge was not itself a renewal. We determined them eligible at their last renewal for, and they're continuing based on that. Other question was on continuous eligibility, and if someone reports a change in job that comes with affordable health coverage, does that person still have continuous eligibility, or will the coverage end? So we addressed this a little bit with the chart earlier. This is part of what provoked that chart's creation. But there's a difference between the two programs here, whether or not they even have continuous eligibility in the first place. Only a basic Medicaid member would have continuous eligibility. The basic health program members will instead get that 12-month coverage protection. In either case, there's the special rules for OHP Bridge members being on other programs. For the in general, you can't have that coverage, but if you report that coverage during the middle of a coverage period or continuous eligibility period, it's going to depend which of those two programs you're on and whether or not you enrolled or have access to it. So for basic health program, if you have access or enroll in the other coverage, you're going to lose the basic health program at the end of the month following our normal at least 10 days minimum notice timelines. So right now it would be at the end of the current month. If you are on basic Medicaid instead and you enroll in the other coverage, your coverage would end. If you only get access to it and do not enroll in it, then you're keeping coverage until your next renewal, the end of the continuous eligibility period. I feel like I said that a little confusingly, but hopefully that makes some sense to people in concert with the chart we got earlier as well. So been a confusing point for many people. Really would encourage you to study that chart again. We also got a question about sponsorship in OHP Bridge. In this case, sponsorship refers to people who have an affidavit of support with someone prior to them coming to the country and where they've promised to reimburse the government for benefits that person uses and whether or not OHP Bridge counts towards that. Medicaid programs are among one of the things that can count as that, is background context for everyone. So no, despite the outlined benefits, for this purpose, OHP Bridge Basic Health Program does not count as Medicaid for this purpose because we are using marketplace authorities, essentially. There are only 5 means-tested public benefits that count towards that affidavit of support process. That's supplementary security income, cash benefits, Medicaid, and CHIP. We are not Medicaid for that purpose, so it follows the same rules as marketplace tax credits, which do not count towards those affidavits of support. There was also another question in this one. If someone's eligible for OHP Bridge, would they lose their marketplace subsidy? That one's a yes. If someone is eligible for OHP Bridge, they are no longer eligible for tax credits in the marketplace. We also have been hearing quite a bit, just how do I apply for OHP Bridge? This is a pretty basic one, but we want to really reiterate this. You can apply through any of the systems. There's no wrong door here. Both of them will talk to each other. But for our messaging purposes, the best way to apply is to get help from a community partner near you. If you need to find one, go to oregonhealthcare.gov/gethelp. You can also apply online at one.oregon.gov. That link also has information about how to apply in person at your local office if you need to, or to get help and how to file a paper application if you want to go that route. So any of the normal OHP application routes work. You can also apply through the marketplace and it'll refer you over, though the timelines are going to be a little bit slower there. As always, our call center, the 800-699-9075 number, is able to help people apply directly 7 a.m. to 6 p.m. Generally, though, it's following the same application routes. It's going to feel very similar to OHP and all those sorts of processes. So just spreading that word. Is there coverage like this for Washington residents? And the answer there is no. This is unique to Oregon. Only Minnesota and New York have similar programs. Washington residents can find their coverage options at washingtonhealthfinder.org, which is their equivalent to the oregonhealthcare.gov website. We also got a question from a nurse home visitor who is wondering whether her client who has insurance coverage, it sounds like they're underinsured and it might not be the best employer plan, whether they might be eligible for OHP Bridge. In this case, it's going to be the affordability standard again, using those same marketplace rules. If it's more than 8.39% of her gross monthly income, then that plan would be unaffordable. If that plan is unaffordable, she'd be able to get Bridge. If it's affordable, though, she's probably not going to be eligible. Applying is the best way to figure that out. The system will run that all for you. Okay, I think that brings us to the end of the questions we had set up for this. And now it brings us to open discussion time, where if you have any questions that you'd like us to try to address right now, we will take our best stab at that with all the experts we have on hand. Otherwise, we will take those back and report back to you if we need to. But would open the floor to any questions we might have brought to mind.
Well, if we weren't overloaded on information before, I certainly feel like we might be now. So appreciate you guys sharing out these slides. I will send out the slides as well as the recording. So if anyone's in the audience, they need more time to think about this before you submit a question, we encourage you to do it that time so we can discuss it at our next meeting. Yeah, I don't see anything else in the Q&A or in the chat, but like I'll do another going once, going twice sort of thing. And if no questions today, we will give you time to submit them and talk about them next month or address them individually as they are sent to us. So, oh, look, we got one. What is the best way to prove annual income for the bridge program? My client has earned more income last year, will earn less this year. Will a written notice suffice?
Providing a written notice like a written explanation along with whatever you have available, for instance, tax returns from a previous year can be helpful. But the written notice, if there's differences between what the documents from last year or whatever you have available currently would show, explaining those differences and why the income you put on the application is different from the materials you have available is a very wise move. That'll help it get accepted.
Makes sense to me. All right, looks like some people are logging off and saying thank you. They really appreciate you guys taking the time to go over all these topics in such depth. It is at time, so if you didn't get a chance to ask your question today, please reach out to us, and we'll see you all next month.
Thanks, everybody.
Thank you.
Thanks so much.